Good morning, dear students. Today we are discussing about the gluteal regions and back of the thigh. We are introducing for the gluteal region of the muscles and back of the thigh muscles for the nerve supply and the blood supply. The objective of this topic, this lesson lecturing, the student should be able to identify the content of the gluteal regions and group of gluteal muscles and small muscles and nerve supply and actions. After that, we want to know about the foramen. For the greater sciatic foramen, lesser sciatic foramen. The back of the thigh is hamstring muscle. The posterior gluteal region, the extensor gluteal maximus, adductor gluteus medius, and rotator of abductor introsus and quadriceps femoris. The contact. The muscles, they have the gluteal, have the three muscles. The gluteal maximus, gluteus medius, and gluteus minimus. The three muscles is combination from the gluteal region of the superficial muscles. The group of small muscles, there are the piriformis, abductor introsus, superior gamma, inferior gamellus, quadratus. The nerve supply, there have the sacral plexus and coccygeal plexus. They have nerves for the all sacral plexus. The sacral plexus, there have the sciatic nerve, superior gluteal nerve, and inferior gluteal nerve. After that, posterior cutaneous nerve of thigh and nerve of abductor introsus, nerve of quadriceps femoris, and peduncle nerves. The superior gluteal nerve and inferior gluteal nerve, sciatic nerve, profundus nerve, and the posterior femoral cutaneous nerve. The blood supply of the gluteal region. The gluteal region, there have the vessels for all the internal iliac vessels. The superior gluteal, inferior gluteal, and internal peduncle vessels. The greater sciatic foramen. The greater sciatic foramen for the greater sciatic notch of the hip bone is transferred from the foramen by the sacrotubercles and sacrospinous ligament. The structures passes throughout the greater sciatic foramen. The piriformic muscle, the above the piriformis muscle, there's a superior gluteal nerve and vessel. The below the piriformis muscle, there have inferior gluteal nerves and vessels. After the sciatic nerve passes through the greater sciatic foramen, the posterior cutaneous nerve of thigh. After nerve of quadriceps femoris, and nerve of abductor introsus, the peduncle nerve, internal peduncle vessels. These all the things we passing throughout the greater sciatic foramen. There are supragluteal artery and vein and inferior gluteal artery and vein. The lesser sciatic foramen, the lesser sciatic notch of the hip bone is transverse into the foramen by the sacrotubercles and sacrospinous ligament. The structures passes throughout the lesser sciatic foramen. A tendon of abductor introsus, nerve of abductor introsus, peduncle nerves, and internal peduncle nerves. Gluteal muscles. The gluteal muscle, already we discussed the gluteal maximus, gluteus medius, and minimus. We know about the gluteus minimus origin. The gluteus minimus origin is the anterior part of the gluteal surface of ilium. The gluteal medius part of the great gluteal surface of the ilium. And gluteus maximus, the posterior part of the gluteal surface of ilium. This throw muscle, the three muscle origin for the gluteal surface of the ilium. But main origin is gluteal maximus, is the origin from the back of the sacrum and coccyx and back of the sacrotuberous of the ligament. Is of the gluteal medius, gluteal minimus. Gluteal muscles we saw already see about the origin. Now we are see about the insertion of gluteal muscles. The gluteal minimus insertion by the anterior surface of the greater trochanter. The gluteal minimus is insertion by the lateral surface of the greater trochanter. Gluteal minimus is insertion by the iliotibial tract, and the other insertion is gluteal tuberosity of the femur. This is the insertion of the gluteal minimus, medius, and maximus. The gluteal minimus insertion is anterior surface of the greater trochanter, and gluteal medius insertion for the lesser surface of the greater trochanter, and gluteus maximus is main insertion of the iliotibial tract, and other insertion is the gluteal tuberosity of the femur. Nerve supply and action of the gluteal muscle. The gluteal medius and minimus, the main nerve supply is superior gluteal nerve. The action is the adduction of and medial rotation of the hip joint. The gluteal medius and minimus nerve supply is superior gluteal nerve. This action is the abduction and medial rotation of the hip joint. Also, they provide the tilt of the pelvic on the rising of the other limb from the ground. Thereafter, preventing the tilt of the pelvis and raising the other limb of the ground. Gluteal maximus. The gluteal maximal nerve supply is inferior gluteal nerve. They are inferior gluteal nerve. The action is extension and lateral rotation of the hip joint. Throughout the attachment to the iliotibial tract, the stabilizing the femur and tibia during the standing. The gluteal maximus main action is extension and lateral rotation of the hip joint. Throughout its attachments to the iliotibial tract, is stabilizing the femur and the tibia. Small muscles. The small muscle, there have the abductor interosseous. The abductor interosseous origin of this muscle, the inner surface of the side wall of the pelvis. They origin from the inner surface of the side wall of the pelvis, and the insertion is the medial surface of the greater trochanter. The insertion is the medial surface of the greater trochanter. Nerve supply. The nerve of abductor interosseous nerve. The superior and inferior gamma. The abductor interosseous nerve, interosseous muscle, the nerve supply is now to the abductor interosseous. Coming to the superior and inferior gamma. The superior and inferior gamma, origin is the superior gamma muscle, the upper part of the lesser sciatic nerve. The origin from the upper part of the lesser sciatic nerve. This is the origin of the superior gamma. Coming to the inferior gamma is origin from the lower part of the lesser sciatic nerve. The upper part of the lesser sciatic nerve is origin from the superior gamma, and the inferior gamma for origin from the lower part of the lesser sciatic notch. Insertion, the upper and lower part of the tendon of the abductor interosseous. The insertion of the superior and inferior gamma muscle is upper and lower part into the tendon of abductor interosseous. Now supply superior gamma, now supply abductor interosseous, now inferior gamma, now to the quadriceps femoris. The superior gamma now supply to abductor interosseous, now the inferior gamma now to the quadriceps femoris. After the small muscle, there are the piriformis and quadriceps femoris. The piriformis muscle origin from the pelvic surface of the medial three sacral vertebra. The origin for the medial three sacral vertebra. The insertion is passes through the greater sciatic fossa to the greater sciatic foramen to be insertion into the upper part of the greater trochanter. The origin from the middle three sacral vertebra, insertion from the greater trochanter. Now supply is anterior rami of sacrum 1 and 2. The quadriceps, coming to the quadriceps femoris, the origin from the lateral part of ischial tuberosity. Insertion is quadriceps tubercle and the interquadricular crest. Now supply is the nerve of quadriceps femoris. See, again we know about the piriformis origin from the three sacral vertebra. Insertion is the greater trochanter. The anterior rami of S1 and S2 for the nerve supply. Coming to the quadriceps femoris, the lateral border of ischial tuberosity. The insertion is the quadriceps tubercle and intercondylar crest. Now supply is now quadriceps femoris. The action of these two muscles, lateral rotation of the hip joint, controlling movement of the hip joint. These two muscles similar actions for the lateral rotation of the hip joint and controlling movement of the hip joint. Next, coming to the nerves, nerve of the gluteal region, superior gluteal nerve. The superior gluteal nerve causes is the passes throughout the greater sciatic foramen above the piriformis and then between the gluteus medius and gluteus minimus muscles. They passing through the greater sciatic foramen above the piriformis through between the gluteal medius and minimus muscles. The branches for the maxilla to the gluteal medius and minimus and tensor fascia laterally. The articular to the hip joint. This is the superior gluteal nerve. The inferior gluteal nerve, the causes from the passes through the greatest sciatic foramen below the piriformis, then deep to the gluteus maximus. The branches of muscular gluteal maximus. The nerves to the cortices femoris. The causes is passes through the greater sciatic foramen below the piriformis. Branches is muscular quadriceps femoris and interior the articulation at the hip joint. This is the nerves. These three nerves is passing through the gluteal region, the superior gluteal nerve, inferior gluteal nerve, nerve of gluteus femoris. These three muscles passing throughout the greater sciatic foramen. And the posterior cutaneous nerve of the thigh, the passes throughout the greater sciatic foramen below the piriformis, this descending deep to the deep fascia. This branches, cutaneous branches to the gluteal region back of the sacrum. This is the laminae of major, back of the thigh and upper part of back of the leg. The sciatic nerve, this is the sciatic nerve passes through the greater sciatic foramen below the piriformis, then superficial to the ischial spine and superior gamulae, the tendon of the obturator introsseus, inferior gamulus, the cortices femoris and adductor magnus. These all branches, there are no branches of the gluteal region. The sciatic have the no branches of the gluteal region. They are only they are divided into the tibial and common peroneal nerve, into the medial of back of the thigh. This is the sciatic nerve only branches for the tibial and common peroneal nerve. Posterior compartment of thigh. The posterior compartment of thigh, the content of muscle have the hamstring muscles. The hamstring muscle is the group of muscle. The hamstring group of muscle, they have the biceps femoris, semi-tendinous, semi-membranous, ischial part of adductor magnus. The four muscle is combined for the hamstring muscle. The hamstring muscle is biceps femoris, semi-tendinous and semi-membranous and ischial part of adductor magnus. The blood supply, the branches of profundus femoral artery. The blood supply of the hamstring muscle is branches of profundus femoris artery. Nerve supply of this hamstring muscle is sciatic nerve. This is the main sciatic nerve branches from the hamstring. We can know about the origin of these quadriceps muscles. First, we know about the quadriceps muscle of the biceps femoris. The biceps femoris is origin for the long head of the ischial tuberosity. The long head of the ischial tuberosity origin for the biceps femoris. And short head is origin from the line of aspera. They have the biceps femoris. They have the two head of the muscle. There are the long head and short head. The long head of the biceps femoris is origin from the ischial tuberosity. The short head from the origin from the line of aspera. This to both biceps femoris is insertion into the head of the fibula. Nerve supply of the biceps femoris. The long head is supplied by the tibial part of the sciatica and short head of supplied by the common peroneal part of the sciatica. This of the sciatic nerve branches only supply this nerve supply the tibial part of sciatica and common peroneal part of the sciatica. The actions of biceps femoris. The actions of biceps femoris is flexion of the knee, the lateral rotation of the flexed leg, and that long head is extended extend the hip. The action of the biceps femoris, the flexion of knee and lateral rotation of the flexed leg. The long head is semi-tendinous. The semi-tendinous origin from the tuberosity, ischial tuberosity. The origin for the ischial tuberosity. The semi-tendinous is origin from the ischial tuberosity. Insertion from the upper part of the medial surface of the shaft of the tibia. Now supply the tibial portion of the sciatica. The action of the semitendinous muscle, the flexion and the medial rotation of the leg at the knee joint. This action of the semitendinous is more important, the flexion and medial rotation of the leg at the knee joint. The same time they are doing the extension of the thigh at the hip joint. They have two actions, the flexion of the knee joint and the extension of the hip joint. Semi-membranous. The semi-membranous is the origin for the ischial tuberosity. The origin from semi-membranous also origin from the ischial tuberosity. The incision is the posterior surface of the medial condyle of the tibia. There the incision is formed the oblique of popliteal ligament, which is the reinforced of the capsule on the back of the knee joint. There is the more important incision. There have the back side, the knee joint. The posterior side of the knee joint is stabilizing by the oblique popliteal ligament, which is the reinforced the capsule, the back of the knee joint. The nerve supply the tibial portion of the sciatic nerve only. The action of the flexion and medial rotation of the leg at the knee joint. Semi-membranous action is flexion and medial rotation of the leg at the knee joint and extension of the thigh at the hip joint. Adductor magnus. The adductor magnus have the hamstring part. The adductor magnus origin from the ischial ramus and the ischial tuberosity. The adductor magnus origin for the ischial ramus and the ischial tuberosity. Insertion for the adductors tubercles of the medial condyle of the femur. Now supply the tibial portion of the sciatica. Action is the extension of the thigh at the hip joint. The action is extension of the thigh at the blood supply of the posterior compartment of the thigh. The four profundal branches, the profundofemoris artery, providing the rich blood supply of the posterior compartment of the thigh. The same time, there have the venous supply. The profundus femoral vein is drained from the greater part of the blood from the posterior compartment of the nerve supply of the posterior compartment. The nerve supply, the sciatic nerve passing through from the gluteal region to the posterior compartment of the thigh. The sciatic nerve branches is the sacral flexus, the L4 and L5, and S1, S2, and S3, the level of gluteal region and descending to the midline of the thigh. It's overlapped posteriorly by the adjacent margin of the biceps femoris and semi-membranous muscles. The origin of the one side they are protected by the biceps femoris and other side is semi-membranous. After the lies the posterior aspect of the adductor magnus. The lower third of the thigh end is divided by the tibial and common peroneal nerve. The sciatic nerve have the branches lower third. The thigh it ends by dividing into the two parts. That is called tibial nerve and common peroneal nerve. Thank you. This is the posterior compartment of thigh and the gluteal regions. Thank you for watching.